Kill off every cancer cell, you're probably safe. It's like in a war on terrorism, you go in a country and very precisely kill off everybody who is a terrorist. But we rarely do that, so they're survivors, they're empowered, they respond. In the case of cancer cells, there are two mechanisms by which a not 100% successful therapy will promote progression. One is, as I mentioned, at the level of individual cells, the cancer cell will become cancer stem cells. But then there's another mechanism that we just recently realized, and actually it's the old knowledge, and that comes from a lot of work together with my long-time collaborator, Deepak Panigrahi at the Harvard Medical School. And that is that when you kill a lot of tumor cells, what happens with the dead bodies of every single cell, every single cancer cell dies and stays there. So in normal tissue, when cells die, they never die in these masses, but when they die, they get eaten up by specialized cells. But in the tumor, when we irradiate or kill with poisons a lot of cells, then this cell debris stays there and triggers an inflammation. Now, inflammation, as I mentioned, is part of the surrounding of tumors that can modify the course of cancer, and it can actually promote cancer. But inflammation is very complicated, and it's another double-edged sword, because there are two types of inflammation with respect to cancer. One type promotes cancer, as I mentioned. These cells will come in and create an environment of making the tumor think there's more repair needed, but it's a pathological repair, and so on. And the inflammation promotes tumor. But on the other hand, inflammation is also the first step of the immune response, and it can actually immunize or lead to the immunization of the body, activating immune cells, T cells mostly, that can fight the cancer. And so it's another double-edged sword, another situation where something can backfire, another paradox.